Hi, I'm Cindy Kubika, host of Energized Living Today. And on the show, I have the opportunity to interview a lot of energy practitioners. In fact, many of our listeners are also energy practitioners. Using energy modalities in your practice is not just about the technique itself. In fact, it goes much deeper than that. In many professions, they offer ethical rules and regulations as part of their training. And yet, in many energy modality trainings, they don't offer this until much later. And these are to safeguard not only you, but your client. This discussion was organized to identify and highlight these needs. So we have brought together 4 top energy experts to help you with their insight. Fiona Truman is a certified EFT Level 3 trainer. She is credentialed by AAMET, Association for the Advancement of Meridian Energy Techniques. She is directly trained under the matrix reimprinting developer Carl Dawson and faster EFT creator Robert Smith, receiving certification in both modalities. She is also the first certified trainer for picture tapping techniques. Fiona is the creator of an exciting new energy technique called mind map tapping process. Catherine Sherritt earned her PhD from Vanderbilt University in 1972 and has been working as a psychologist for over 40 years. Her credentials include over 25 peer-reviewed publications, 4 books, and she has experience in Gestalt therapy, transactional analysis, EMDR, cognitive behavioral therapy, and numerous energy techniques. Casey McCrory has a master's degree in counseling specializing in cognitive behavior therapy, and she now includes energy-based approaches in her practice, including EFT, integrative therapy, matrix reimprinting, and mind map tapping. Karen Davidson has been working and teaching energy healing modalities for over 35 years. Karen is an AHP certified international trainer for EFT, international certified matrix reimprinting trainer, co-author of the EFT Levels course books for certification, an AMT EFT master and trainer, a Reiki master, a hypnotherapist, and the creator of the prenatal reimprinting. Karen has created over 100 training DVDs in various forms of meridian tapping techniques and energy practices.
Dr. Sherritt, what kinds of ethics training do you get?
There will be classes specifically on ethics, so you can have a whole class that goes all semester covering various aspects of ethics. It's not something that we're given a little list of rules and say, go memorize them and you're done. We would discuss the implications of this ethical rule or regulation and how it has boundaries and how it might be violated and how you might be challenged in different ways to hold on to the ethics and regulations. Among them are the issue of doing therapy with friends or family, which we can't do. One of them would be that we can't use testimonials. So if we work with a client, the client feels as if they got a really good outcome, we can't say, our clients say that we were helpful to them in this area. So we can't use any kind of testimonial. We can't say that we're experts in any particular area. We can stipulate that we've studied a particular area or have a certification in a particular area, but we can't say that we're experts in that area because that would be implying that we could, that's implying a guarantee that we could help people. So there are several aspects of ethics, and it would vary according to what theoretical perspective you're part of, because if you're psychoanalytic, you wouldn't see more than one member of a family. But if you work in cognitive behavioral therapy or some other approaches, you could see more than one member of a family.
As Dr. Sherritt was saying, we did take an ethics class, and not only did we take the class, but we were given scenarios that we had to complete in order to learn about how that would happen in your practice. And then also we took a test afterwards. Ethics, was a big part of our exam to graduate. Another example of an important ethical rule is not having romantic relationships with your clients, and that was very important too, because like you said, you may not only see just one member. If you were a marriage and family therapist, you're going to see the whole family. So you're going to meet lots of people and have lots of interactions, and it's important to know your ethical limits when working with people.
And Fee, what about in UK?
Yes, I was just thinking about that because, you can be really good at what you do, but you're not allowed to tell anybody what people think of you. And I'm thinking, but that's the best way of telling people. So yeah, we would very happily use testimonials. You've got to be careful, obviously. We don't say cure, we don't use words like that, but if somebody thinks that they have really got benefit from working with you, we would show that.
What about ethic training?
Ethical training will come... No, there's no ethical training as such. Ethical training is available if you join an organisation. There will be a code of conduct and ethics, the guidelines to tell you what you can and can't do. You mentioned romantic relationship. It is very clearly written in the code of ethics, that if a client is starting to show a romantic attachment to you, straight away you refer them on. You refer them on immediately. And going back to family members, you work with somebody, you do a good job, and they refer you to a member of their family, and they come and see you. So, yeah, probably not taught, because obviously, I think we're going into confidentiality there, which we'll probably cover later on. But, that's obviously going to be an important part of it. But yes, I would not refuse to see a member of the same family.
If a client developed a romantic attachment to you, you would immediately refer them on.
Immediately.
Right.
Yes.
So in a therapeutic situation, that's considered a transference, that the client is developing an attachment to the therapist that is not entirely therapeutic. That becomes part of the therapy. And so we would deal with that as another issue. What's going on that you're feeling romantically attached to me, or not even romantically, but clients say, well, let me take you to lunch. Well, I found this scarf, this briefcase, this whatever, let me give you this. And that too would become part of the therapeutic situation. We wouldn't take the gifts, but it would be what's going on between us that you're wanting to take me to lunch, to buy me things, to have a relationship.
We would still deal with that, but with somebody else. That is part of the issue, yes, but it's not for us to deal with. That's what we're guided.
Yeah. And that makes sense.
It's the same in the U.S. too. We wouldn't, we could do things like barter or take gifts, but we're not trained. I'm not licensed. We're not trained. Where is the boundary? Where do you stop? And what I would never do is put that in. I would probably think that, and how do I work with this as part of the therapeutic condition that you want to give me a present? But I wouldn't have thought of that 15 years ago when I started doing this. I might take the present, because, I know that this client is feeling very close to me and they want to give me a little, thing from my office. That's happened. And I would take that. I would take the gift, not knowing.
Right.
Because I didn't know. And it didn't seem harmful, but
right.
That I just absolutely would never, it just never dawns on me that would be a bad thing.
And it's a gray area, because I can't say that I've never taken something from a client. If a client brings a small Christmas tree ornament or something from my office that is very clearly inexpensive and they just saw it and thought of me, happens one time, that's fine. I might accept it. Where it would become a problem for me, and where I would definitely want to bring it up as a therapeutic issue, is if this client kept bringing me things. then
it was large and expensive.
or it was large and expensive.
Yeah.
Either way, then it has to become part of the therapeutic process.
Yeah, I see. I don't think that when you're first beginning, you know those lines. That you, I mean,
Yeah,
you
it would
wonder.
be difficult to know.
but we cover those
You're
in
taught
our
those.
ethics. We are
You're
in
taught
fact
those.
very
Yeah.
specifically taught where the lines are. So in some ways, it's easier for us to deal with those things because I think we have clearer lines than you do.
You know, we
Right.
just have to be more careful, especially over here. A lot of it comes from knowing what's right and wrong. We do a lot of things like our gut feeling, there's something going wrong here. There's
Yeah.
something
Yeah.
too much here. You know, we're taught that. And, you know, as a trainer, I teach EFT and matrix re-imprinting and those kinds of things that I do. You know, I throw that in, but not until level 3. You know, you have the paperwork that you have to sign, but it's not discussed in detail. And that's something that we're changing a lot now. We're trying to put ethics training into it. When people like David Feinstein has written the ethics book and Dorothy Kramer, and you know, we know how important this is. Instead of just saying, "Oh, you'll do it. I'm sure you'll take care of it." You know,
Right.
You need to know what they are.
Yeah, you need to know.
And even knowing it, I mean, there are psychologists every year who lose their licenses because they learned the rules and ethics and they did not implement them.
All right.
Yeah.
So, if you don't even know what they are, I think it's much harder.
It's even more.
At least if you know what they are,
Yeah.
you have an opportunity to implement them appropriately. But I think it's important, this is a good time for us to talk about supervision, because from my perspective, and I've had my PhD for over 40 years, I still ask other people if there's anything that I have a question about. So it could be someone else who's practicing in the field. I could call the board and say I have the Board of Psychology. I could talk to a variety of people. Like I could read something. So from my perspective, I still have a lot to learn.
And I want to talk about that word, supervision,
Okay.
because I know in the UK they call it supervision. Here in the US, we non-licensed people can't call it supervision. We have to call it mentoring, because then I am responsible for what you do because I'm your supervisor. So it's something that we have to be very careful of, that we are mentored, we are not supervised, unless we are working in a body massage clinic doing EFT or something like that. Then we can have a supervisor. We can have mentors, we can have people that we turn to for questions, we can do that, but we don't call it supervision. Because legally it can get people in trouble.
And we do require supervision so that after you've done your coursework, before you go out, or at the time that you start going out and actually practicing on people, you absolutely have a supervisor. And yes, the supervisor is responsible for you.
Okay.
So not only is the intern or practicum student responsible for what they're doing, the supervisor is absolutely responsible for what they're doing. And the supervisor is expected to know.
And we do that, and now the programs do it for thousands of hours. There are thousands of hours we have to practice
Right.
under supervision in order to get our full license in counseling.
Thousands of hours.
3,000 hours plus, because there's a practicum while you're in school, and there's an internship you also do while you're in school, both of which have several hundred hours each. And then when you get out of school, when you have your graduate certificate, you then go and start your licensing process, which is 3,000 hours. In most states, there's a few states that are different, but it's about that in most states.
And we do 12 hours of group mentoring that is required before the first.
Yeah.
And but you don't even have that. You can go tap on people, or you can go, if you're not, like you said, Fiona, if you don't go to a certain organization. And I'm putting like Eden Energy Medicine. You can go to a workshop. And I'm just throwing different modalities out there, and you can start using it. You can start using EFT. You can start using matrix re-imprinting before you're certified or anything. And that's part of the reason why we're having this conversation, is because you don't know what you don't know.
You don't know what you don't know. That is exactly it.
And you don't find out until things happen.
Until things happen.
It's like insurance. You don't need it until you need it.
And then you need it right now.
Which is why you should have a lot of people, especially if you're non-licensed, you should have people to call and to ask when you're in a situation and not just try, oh, I think this is a good idea.
Well, licensed or not licensed, I think you need to have people to call. I think that's our point, is that we have formal supervision, and we also have mentoring, but that's a little more informal, so that you can have a supervisor and you can have someone that you just talk to, but that wouldn't necessarily be recorded anywhere. That's not a requirement.
And I think there's a lovely thing that the energy community does, which mentoring, but also swaps.
Yes.
I think those are wonderful because you are getting not only your own work done, which I think is incredibly powerful for becoming a practitioner, but also you have someone else who's supporting you. So you end up having a support group rather than this one person you report to.
It's not a requirement, though. It's just something that happens.
Yeah, I'm just saying that it's not something that I would be allowed to do. In my license, it's like that's like bartering. That becomes like a barter in a licensing situation. So I'm actually not. I wouldn't be able to do it. So
Are you prohibited from doing it?
I am. I'm not sure about the word prohibited.
Okay.
But I think it's
Sort of not done.
It's not done.
Different from
Right.
prohibited,
Okay.
but not done.
Yeah, because it becomes into this gray area about bartering or trading, which is not acceptable.
Well, it also gets
a-
into the issue of the therapist does not become the client
Yes.
of their client.
Oh, right.
So if you're my client,
Mm-hmm.
you're my client, and then we can't turn around and have
Right.
you work with me
Right.
as a client.
Well, that's a massive difference.
That is a massive difference.
Yeah.
Because we do swap.
Yes.
Yeah,
And we encourage it.
Yeah.
Yes.
Because
Absolutely.
it gives you a
Right.
chance to understand
What it's like.
what it's like for both sides.
Yeah.
with the same person who has.
Yes.
Right.
So
right.
be aware that one can be licensed in many areas of therapy without ever having been a client.
Ever having been a
But Fiona and I are going,
Right.
oh my goodness.
Now that's not true in some other areas. There are some areas where you are required to have been a client in order to get your degree or in order to get licensed, but not in other areas.
You couldn't be a client of somebody else in the same. I mean, and I know that's
Right, you could be, but in some areas you generally aren't a client. So, say cognitive behavioral therapy does not either require or encourage you to be a client. You are encouraged to learn how to be a therapist. It's kind of one-sided. And so you report to your supervisor, either audio or video recording. They see what you're doing. They encourage you to move in this direction or that direction to become a better therapist,
Yes.
but you don't necessarily have any idea unless you decide on your own that you need therapy. You have no idea what it's like to be a client.
Go ahead.
I was just going to say, yes, the structure of that is very much up and down.
Right.
Whereas when you were talking about energy, the swaps and things, it's more this way, we're more
And that's
talking
how we're
about-
actually taught to work is instead of
Right.
like this, where you're just this much above and you're kind of,
Right.
you're a facilitator. You're walking side by side your client, beside your client,
Right.
and rather than figuring out what they need or figuring out anything.
or being
Right,
responsible
right.
for their process. And
Exactly.
instead you are just responsible for yourself and your tools and what you bring to the table, and they're responsible for themselves and their tools and what they bring in together.
So here's my question:
Okay.
since you guys are traditional and licensed,
Yeah.
and you both do energy work,
Uh-huh.
First of all, I'm not going to say which is better because that wouldn't be fair. But I'd like to say, you've had the experience of both. There's positive and negatives to both.
Positive and negative.
So can you talk about that a little bit?
In some ways, it's easier, I suppose, for me to talk about it because I went through a very traditional program, got my PhD in psychology, was never required, encouraged, or the idea mentioned that I would be a client. That was really not a relevant issue. And then after the basic training, I did the internship, and I was again a therapist for people under supervision. And it wasn't until later when I became involved in other kinds of therapies where there is more of a side-by-side. Gestalt therapy, for one. There's very much the idea that there is a collaborative co-creation of an activity, event, therapy between the client and the therapist, so that the therapist is not above the client but beside the client. So there are some traditional therapeutic approaches within which you would be expected to get therapy as a therapist. For example, when I took an extended training program in Gestalt, that was the first time I was required to be in therapy in order to participate in a training program. So there are some approaches other than the energy work where you're required to get experience.
I'm fairly sure that in psychiatry in the UK, it is a requirement that they work on themselves. That, they are a
That would be
client.
psychoanalytic.
Yeah.
In the psychoanalytic program, you are generally expected to be a client and have done your own analysis.
But as I'm not licensed, I
Right.
don't know.
Right, but I don't know that our psychiatrists have the same requirement. I could be wrong, I can't actually talk about that, but I can talk about psychology.
Yeah.
I'm amazed that you could. I'm still in shock sitting over here that you could not ever be a client because you learn so much.
Oh yeah.
Not to mention doing your own work, but you
Get your own
learn
stuff
so much.
Really,
You know.
what it's like to be on the other side of the desk, on the
Yes.
other side
On
of
the
the chair, on the
receiving end.
receiving end,
Yeah.
or the cooperative this end. But let me give you an example of a statement from someone who uses cognitive behavioral therapy from a one-up, one-down position. And this person was talking to me and said, well, I got my client to do this homework assignment, and that was a really good thing. And now I need to get them to do the next thing on the list of work that I have for them to do. So who's in charge? Who's running the show? This is a therapist who's creating a list of things that the client must do. And I'm certainly hearing a one-up, one-down.
And I often think that's one of the reasons why therapists have so much burnout.
Ah,
Is due to the fact that they're
yeah.
doing so much work to get the client to
get the client
do
to
something. And so they're spending so much energy getting
Absolutely.
them to do something that
Absolutely.
they're spinning their wheels sometimes when the client is resistant or doesn't want to. And so that's got to be exhausting for the therapist, and I can see
Right.
how that might be.
Well, what traditional therapy concepts? Because you are in energy
Right.
modalities as well.
Right.
Are there? Where are they similar? Are there things that, or where does it fit in well?
What I find is that clients generally come, whether I'm working with them in standard therapeutic approaches or energy modalities, believing that they are constrained by their situations, by their histories, by their personal limitations, by something they can't do anything about. And so they are miserable, and it's just kind of hopeless. So I'm in therapy because therapy is where you go when you don't know what else to do. But could you really fix my partner, my neighbor, my siblings, my children? I really wouldn't be depressed if my children didn't act like, whatever. And so for whatever approach I'm using with the client, it is to help them recognize that they have the power to change themselves. And that often when they change themselves, they have a different view of their relationships with other people. They have a different view of themselves. And in fact, what they're doing in their lives, they have a dynamic aspect to it. And when they change themselves, almost everything else around them changes.
I think we'd all agree with that.
Yes. Well, I'm now out of shock now.
That is the similarity. across
That
the
is,
board.
that
It
is,
really
that's what we're all
strikes
trying
me.
to do, is to
Yeah.
get them through
Yeah.
to knowing that they can do it themselves and that they
Right.
there can be change. I wanted to ask you something, because you're just a little bit younger than Kathy's been around. No,
Really
no
less time
offense.
around.
And so I'm wondering how much it's changed.
When going through graduate school, there's no mention of anything that could possibly have anything to do with energy. At all. Ever.
Then
And so that's interesting. And I noticed that the people who are interested in that don't go to graduate school. They go to massage school. They go to energy training. They go to these other alternative programs. They don't go to graduate school. And then I've noticed that in order to get into these things, you have to be introduced in a what's the word?
someone that
in a
you-
non-traditional way. Basically someone who knows about it and who kind of tells you, whether it's your massage therapist or your therapist who's interested in multiple modalities of things and is doing some energy work, and thinks outside the box of traditional counseling. Or
So would you
traditional-
listen? You're obviously gonna, if Kathy introduces you to it, you're gonna listen. But what if I introduce? How would I introduce this to you without shoving it down your throat? Or, I mean, the obvious thing is like, you're missing this. It's not what you're gonna do.
Right.
So what shifts you? I don't want to say shift. How can you put it together? Where would you be open to allowing this to be a part of your practice?
I think there are a lot of different doors to getting in for different people, but a few that pop in my head would be the introduction of how simple it is, and that someone could see how simple it is. Not them doing it themselves, but seeing someone do it and see how simple it is to really change them, make changes for them.
And we've been having a laugh over the last few days about the differences between British English and American English. Now, it may be across the board that energy, just the very word of it, puts some people off.
Yes.
So I have seen traditionally trained people who have taken these techniques within their practice, just using them via the back door and calling them stress relief techniques, coping skills. And it's just a language thing, isn't it? If you say energy, I'm also still an accountant. Oh, don't talk to me about energy. I want a proper person. But do you know what I mean? It's just language, isn't it? So it is very important to find that bridge so that people can hear it
Yes.
for what it is.
And
Yeah, that's probably the
I'm training,
very
I
start.
train and both licensed and non-licensed people in these many energy modalities. And I had a licensed clinical social worker in my class, and she is like, but it's called EFT. I want to be able to say EFT in my counseling job. I want to call it EFT. And I have a sense of humor. I said, too bad. It's not time yet.
Right.
Yeah.
It's a stress reliever. It fosters cognitive shifts.
A relaxation technique.
Yep, it's these are the things you have to say. Give it time. I always say, you don't win Monopoly by cheating. You have to follow the rules to be able to win in Monopoly. And if you want to get these kinds of techniques into traditional, whatever your traditional is, then you have to speak the language.
When I was in school, when I was in graduate school, autism was caused by refrigerator parents, particularly cold mothers. So when a child was diagnosed with autism, immediately a finger was pointed at the mother. You did not nurture this child. And if anyone's seen the movie Temple Grandin, you see the interview where she's with the doctor, psychiatrist of some type, and he's saying, send your husband in, I would like to talk to him about what's going on. And the mother says, I'm competent, talk to me. Well, I basically don't want to say this, but you caused this by not being available to your child. And I'm paraphrasing, but that was pretty clearly the message, and that's what I was taught when I was in graduate school, that parents cause these things. We've come a long way, and so we have a little more sophisticated ideas than blaming mothers for everything that went wrong in a child's life. But let me say that I started studying energy psychology at a time when the American Psychological Association did not give me continuing education credits for it. So I had to meet the continuing education credits for my profession, and then I took energy psychology credits because I wanted to learn that information. Interestingly enough, just a couple of years ago, the American Psychological Association decided to approve continuing education credits from Association for Comprehensive Energy Psychology. That's the only organization at this point that they accept the continuing education credits from. So I have been in psychology when energy psychology was simply not accepted by the American Psychological Association. I have seen it change, just as I've seen other things in psychology change. And so for that reason, because I know I was taught things that were not true, back to the autism, I know I was taught things that were not true. I considered incumbent upon myself to stay apprised of potential changes, to be aware of fads and ideas and approaches that come and go. And I feel responsible for keeping myself up to date, continuing to learn. And the fact that something has not yet been accepted by the American Psychological Association means I need to be wary and careful, but that doesn't necessarily mean it's a bad thing, because it could become a good thing.
I've been approved as a CE provider for National Association of Social Workers, and that was more thrilling to me than my bachelor's degree, because I'm, like we're talking about, you're trained in this. All I want you to use is to see this tool?
Right.
Can you put this tool in your toolkit? And just like what you're saying, there's so many hours that you need, every year. And if you're not going to get CEs from it, why bother? So there's a balance between what can I learn that I'm keeping myself abreast, and what should I learn and get my CEs. So that you're open to that is wonderful, because there's a lot of people that said no, Karin, I'm not going to come to this class because I've already done my CEs for this year.
Exactly.
So you're going to have the class next year.
Exactly.
Like, okay, so you're going to wait that long before you learn this other modality? Never mind. I can't say that.
No.
Aren't you helping people? Don't you want to learn that? But that's not how it is. I mean, why? If you're not going to get CEs, they're not going to count.
That's
so
right.
That's something that we run into.
Oh, it's definitely something you're going to run into.
So you actually have to put a structure in place, because all of us, we're interested, we're curious, we want to learn. But there are people who go out and say, well, I've done that. I don't need to do anything else.
One of the other things that we non-licensed people don't learn much about, and we hear the word all the time, is boundaries. And I know Fee has a funny story about, because we don't know. People want to tap on everybody, or energy medicine, or let me rub your chakra, or whatever. And,
Right.
and where does that stop? And you're talking about families. We can see families. We can see a husband and wife, even if we're not a marriage counselor, not licensed people. We don't know where our boundaries are, the gifts and things like that.
I had 5 herniated discs in my spine. I'd had surgery. I was, fighting addiction to legal heroin, and I was making sort of improvements very early on after I'd learned EFT. And one of my colleagues looked at me straight in the eyes one day and said, "So, tell me, what secondary benefits are you gaining from this?" And I wanted to punch her. I was walking with a stick. I was battling to get up in the morning. How did I shower? And you're telling me that I'm doing this to myself? You just don't do that. But we hadn't been taught not to do that. The intent was to help. And I can say it surely didn't.
Probably not.
No.
So what kinds of things do people need to learn about boundaries? I mean, what are I know there's a lot, and I know this is one video, but
one of them that we would in fact work on in graduate school is working where the client is. And so the person who is trying to give you help, that there could in fact be a hidden secondary gain to having pain or an illness or whatever when you're just feeling miserable. We are taught to work on what's available to the client, and so that's something that is a little bit easier for us because we at least have that information that it has to go in stages. People's change and walk toward mental health is going to be stepwise rather than, oh, let me tell you what you need to do. If you do this and you do this and you do this and do this, and you are denying the fact that you're, that's probably not going to sell very well. And what happens in therapy is that if you go so fast that you bowl over the client, they generally don't come back. Because you've overwhelmed them, and what they're hearing is, this is your fault. And so I'm telling you that you're in denial of this fact, or you're resisting me, or you're projecting that onto other people. And if we become enamored with our words, we lose the connection with the person. And no matter what approach you're using, whether psychoanalytic or cognitive behavioral or Gestalt, your connection with a person is the foundation for any opportunity to work with someone and help them to find themselves. So that's a boundary. But in terms of touch, what's an appropriate touch? We do boundaries of touch, and do you hug or don't you hug? And let me give you an example, because I do occasionally hug my clients, not everyone. But if I were to have a male client, and if it were to seem appropriate to me that he would benefit from a hug, what I'm going to do is leave my office, walk out in front of my office manager and anybody else who's in the hallway, and say, you know, have a nice day and hope you have a good week, and something like that. I'm not going to, behind closed doors, give a hug to a client who might misunderstand that. It's going to be all completely out there and open.
That's interesting, because one of the things that I noticed when I came over here to the US was that so many people are ministers, and I'm thinking, you know, why? And then I found out that it's because ministers are allowed to physically touch. And I thought, oh, that's interesting, because I'm a tapper. So I will, on occasions, tap on my clients. Now, I'll always ask permission first. I say, is it okay if I tap on you? And I point out the points on the face and the body where I will tap. But that's not a problem.
For you?
Oh. Yeah. I mean, obviously, you use your discretion as well, because if you do have a large bosomed lady, then the underarm point is going to be difficult to get to. So you wouldn't use it. You know, they're just you know, decisions.
Use a different point.
You use a different point. But we don't have a problem with it. Is it okay if I tap on you? Yes. Nothing else to worry about.
And when in trainings, energy trainings, it's been very helpful to learn modifications for tapping on myself to mirror what my client is doing, so that I'm not touching them. Because in the United States, therapists, counselors, psychologists are not allowed, licensed individuals are not allowed to touch their clients.
Well, that's so weird, because in classic EFT we would mirror, but in matrix re-imprinting we're usually tapping on the client.
And I'm curious too, though, in England you say complementary therapist is used to describe even non-licensed people.
Yes.
And so then you're also, anybody is allowed to touch. Is that?
Yeah.
Okay. So are there any, there's no regulations? Yeah. There's no regulations about touching your clients, even if you're not licensed and you're promoting yourself as a therapist. It's all okay.
Yeah.
You just,
I mean,
and like you said,
you say massage therapist, there must be sort of rules, there has to be, but I don't know what they are, but you know, I have learned, you know, the tapping techniques, and yeah, there's no problem. I mean, the only thing that we think about is, you know, sort of what's sort of appropriate.
We do appropriate,
you know, or
you don't see male EFT practitioners or, tapping under here on women on them. You don't see that.
Right.
And in fact, when I first got CEs for National Social Workers and those kinds of things, I had to change the pictures on my website. Because when you teach first to tap on your client in matrix re-imprinting.
Right.
You teach that because it's camaraderie and community, and you're not alone, and all those good reasons. And I realized, Karen, I'm not going to go to your class because you have to touch your client.
Right.
I'm like, oh, I see. Every single picture on my website is everybody tapping on each other,
somebody else.
and you don't have to do that, but.
Yeah.
How would they know if every picture they see?
Right.
Right.
So that's very helpful in the training now, to have learned how to do it. I tap on me, you tap on you. Just follow this process that I'm doing, and we'll go through it together. And that way, and we're separate. And I'm not touching.
But I didn't know there was a problem.
Yeah, you did.
I did not know there was something I didn't know.
Exactly.
As usual.
Right.
Yeah.
And we've been doing this, Fiona and I have been doing it quite a while, so we understand how much you don't know what you don't know. I mean, talk about like intake forms and religious questions that you need to ask. Can you use the word soul? Can you use the word spirit? Can you I've even gone to the point where if I had to say, is there a hell? Do you believe in hell? What happens to us after we die? Because I'm not going to come up to you and talk about past lives, or is this metaphorical? It's the same kind of thing in a different way that you learn through experience. Not to mention, there's been times, if you have a hurt arm, or a broken wrist, you can see that. If somebody's mentally ill, you don't know, and if you haven't been trained to what borderline personality disorder looks like or feels like, you don't know until you are smacked in the face with it, and then it's like, something's wrong here, And so we're taught to use our guts, and we're also taught to, once you know they're out of here, you refer them on, and that's something that we really teach that wasn't taught when I was first learning energy modalities.
Go where you don't belong. It is drummed into us. But it's to say, at what point do you realise that?
You don't. You start. I mean, the first time I had a suicidal client, I didn't know they were suicidal. They had been in a system for a long time, in the mental health system. She knew the trigger words not to say.
So that she wouldn't get hospitalized.
So, yes. So she would not use those words, and I didn't know until I was with two licensed people, and we were, they're very well known in the EFT world and actually in the psychology world as well. And I said something, and they went white. Have you ever seen those movies where you go, Karen, don't move. And you go, why? What's going on? And you just try to look around, but don't move. They were looking at me like that. And I'm like, what'd I say? What'd I say? He says, no, tell me more. Had this person been, in traditional therapy? And I don't know. Well, tell me some things she said. I said, well, she was on welfare. Oh, so we got all these questions. I don't want to go into the whole story because we don't have time.
Right.
But essentially, she was saying to me, I'm at the airport, and I'm going to take the next plane out. And I'm like, are you alone at the airport? Because we're on Skype.
Right.
I'm like, are you alone at the airport? And she said, yes. I said, do you want to get on the airplane? She said, no. I'm like, okay, where do you want to go? And I just went off like this was the most normal thing in the world.
Right.
And we got her, in her mind, we got her home and stuff like that so that she was happy, and I had traditional EFT tapping on this kind of thing. But she was saying is I was going to kill myself. I didn't know this. This makes you realize how something like this video is so important. Yeah. Because you have to always have your radar on, because you weren't. And unless those two of them turned around and looked at me with the white faces, I would have never known.
But you can have your radar on, and when your radar is not tuned to certain things, you don't get it.
You won't pick it up.
You don't get it until it jumps up and bites you, and you're like, something's there. What's there? So back to supervision, mentoring, help.
Yeah.
This just happened to me. What do I do now?
Yeah, if I hadn't had both of them standing, I would have never have known. So now my radar is even better. And I did also ask them, what am I looking for? And they, the kill word, I'm not going to, there's certain words that are triggering. But I have to now look, and that's just this one thing. Anybody says I'm at the airport, I'm like, are you really at the airport, or what's going on? And now I have you ever been suicidal? On my intake form, which I didn't before. And I give my intake forms
Right.
to everyone I teach so that they can learn from my mistakes.
Okay.
Because, and are you on, what kinds of medications you're on? I'll read the medication list. Now, I don't see people who are on medications unless they've been referred to me or they're going to a psychiatrist, and that's one of the rules. But I will take whatever they're on and read it to one of my mentors. And do I need to work, no, that's okay, that's just this kind of medication, because I'm not trained.
How does it change things? Right.
But do I need to worry about this? And do I need to? No, this one's fine. This set, they tell me this set of people you need to be extremely careful with this person, and are they going to psychiatrist? And you have to make sure that they go to their own psychiatrist, because what people tend to do with us is they go, I don't need this medication.
And Karen, where did you get that training to learn that?
Mentoring.
Through mentoring?
Mm-hmm. Through just by knowing I don't know, and so I have people to call, and I will pick up the phone and say, this set of medications, and then I also do, if they do have a set of medications, and I find out that it could be a little bit of, how would we call it, mental issues there, I don't know what the right terminology is.
That'll work.
Then what I do is absolutely, the first time I did that when I was referred to, I made the person go to their I would not get an appointment with them until they were following up. If that day they were going to their psychiatrist, or that day they were going to their licensed person, and then I would phone that licensed person, which is sometimes interesting conversations, because and I said, well, I need to make sure that this person is coming to your office. Do they have an appointment? And then I'm going to call afterwards and make sure that person has showed up.
Came to the appointment.
Came to the appointment. And if not, I'm calling you and saying, you need to tell me this so that I can't see that person anymore. And those are boundaries and rules that I developed without any help. No one ever told me to do that.
Yeah.
It's only because I have to keep, it's part of my job to keep people safe, especially when I don't know what I don't know. Yeah. So we need to have, just like you have people you can turn to, and you have Kathy you can turn to.
Yeah.
I need that especially.
And I was thinking that I think that we were talking about how it's up and down, kind of in the traditional license process, the supervisor, supervisee,
right.
this client, this process, and it's more this way in this. And I think that both benefit from both, if we could have a little bit more of one and a little bit more of the other.
Yeah.
Because I was thinking about, working with clients who may be somewhat unstable and you don't know it, but you have training so that when that comes up, and you're a newbie, say you're a new person to energy modalities, but you have a background in which you are able to identify those things. It's great that they're on a waiver, but also sometimes they know the words, they know what to say to get,
or what not to say,
or what not to say. And so being able to have some background where you, one, know who your support group is and know who that person above you is, that you go, hey, I think this is like red alert, but also that you are getting those red alerts because you've had that training, you've had that practice, and you know how to identify it. Because there comes a time with a client in which I think this relationship is lovely until we get a little unstable, and then you need this relationship immediately. You need to be in charge of that safety, like you're saying, immediately, whatever that means. Because I'm working in a behavioral health facility. One of my experiences was have someone come in. I have no idea they're suicidal. They come in, we're having a great old chat, we're figuring out, we're checking on the medication, we're da-da-da, and all of a sudden they're like, well, and then, last night I was thinking I'd kill myself. I'm like, hello. Okay, who do I call? What do I do? I have a supervisor. And so while I'm waiting for my supervisor to come from the other building, it's taken her 30 minutes because she's caught up in all these other things. I have to contain this person and keep them safe. And I have to manage that. So I'm immediately in this position rather than we're a team. We're still a team, but I'm in charge right now.
Because this
I'm
person
keeping you safe. Because
is
they're
incapable
not
of being part of the
they're
team.
not capable of being on that. So I think that's really important, especially for new people who don't have a graduate school background, or don't have that type of training.
Even simple, tiny things like breaking state.
I teach that in every single one of my trainings. I don't care what the training is, I teach that.
But it's not normally taught, and they taught ab reactions is what they call it, and that shouldn't even be called that. It's just high emotional states. Keep tapping, that's all they say. Just keep tapping. And this is early on. And, you know, they don't say, what did you have for breakfast? Tell me what color the floor is, you know.
It's grounding techniques.
Yeah, the grass, just get them out of the, you know, that state. And it's not taught. So the good thing is in a lot of energy modalities, it's starting to be, they are starting to blend because energy modalities are getting so popular because people want to try something different now if something hasn't worked for 25 or 30 years. They might not give up on traditional therapy, but they would also like to complementary, we call it alternative, healthcare, you know, so that it can be combined. But part of why we're doing this is this taping is so that people can start to understand. And what does it mean then? Things like keeping yourself safe, keeping your client safe, not being attached to the outcome, those kinds of things. What?
Wow. Okay. In 10 words or less?
Yes.
Keeping your client safe, I think, is an extremely important aspect of doing any kind of therapeutic work, whether it's energetic or standard therapeutic work. And in that level, I think that the practitioner is above the client because the practitioner has training the client doesn't have. And so...
Hopefully.
Possibly. Not necessarily. But in general, if the client is getting into trouble, the practitioner is expected to remain a little more objective and see what's going on and continue to provide guidance of some sort. So, and if you're expected to both monitor yourself and monitor the client, then I do to some extent see you as being the leader of this little team. Maybe it's a cooperative venture, but one of you has slightly more responsibility than the other one does. And the one who has slightly more responsibility is the one who's probably the leader of the team to some extent. So keeping your client safe involves learning what are the danger signs. So people might say, you know, I just want to be dead, and that's not necessarily a suicidal statement. It's,
do you want to be dead today, or do you want to be dead forever? Or
well, I might want to be dead forever, but I'm actually not going to do anything about it. And so sometimes, as clarification, what I'll say to them is, you just want the pain to stop. Yeah, I just want to quit hurting. So you want your pain to stop. And it is important to say, are you thinking about killing yourself to be dead? No, I just want to stop hurting. Okay, well, let's try to figure out some ways that you can stop hurting. But the first time you hear somebody say, I want to be dead, then it sounds like a flat suicidal statement. Oh my gosh, this person needs to be hospitalized. And it's going to be terrible. So I think as the practitioner, it is important to become informed about the different ways, subtle ways, someone could say that they're going to kill themselves. For example,
eliciting information. Sorry, it's an important part though, because you're trained. I mean, they say that I start to ask questions.
That's where I'm going.
And that's what you're saying.
Exactly.
But if somebody doesn't know that and is freaked out by it,
right, then are they going to abandon the client and say, I can't see you anymore, I'm going to refer you to Jane Doe, here's the number, you call them and take care of it. This would probably not be a really beneficial way of dealing with it. So I think it's helpful to train practitioners on how to deal with things that might otherwise be so scary that the practitioner forgets that they are in fact responsible for helping to keep the client safe. Now, in standard therapeutic arrangements, we have hospitalization as a resource, so that if I think you're going to kill yourself, then I or someone else with whom I have a relationship is going to have you hospitalized, probably against your will, possibly voluntarily, but you're going there if I think you're going to kill yourself. So it's really helpful for us to differentiate between words that sound scary to us and probably not very comfortable for the client either, and you know, I'm done with this. I'm actually ready to go out and kill myself. And one of the signs might be it's a really flat tone of voice people get when they're done. It's different to say, you know, I'm sick and tired of being miserable. often they still have a little too much anger and a little too much energy to probably kill themselves. I won't guarantee that somebody couldn't say that, because this is an area where one has to proceed cautiously. And anytime the subject of suicidality comes up, we take it seriously. And
It's like the TSA, like going through. If you say bomb,
Right.
they're gonna you're
Immediately,
You're done.
right.
You know?
But on the other
I'm
hand,
flying tomorrow.
if I hospitalized everybody who brought up the subject of I want to be dead or I thought about killing myself, my rate of hospitalization would be a whole lot higher than it is. And so I think it's important not to overreact as well as not to
I think
underreact.
2 key things there was just continue to ask questions, stay calm and continue to ask questions.
Yeah.
And the other thing that I learned is, I'm just going to use an example. You know, I plan to kill myself. Do you have a plan on how to do it?
That's
now,
an important one.
That sounds completely odd to non-licensed people.
Yeah.
Do you have a plan? Okay, what's your plan? I'm going to shoot myself. Do you have a gun?
Well,
No,
yeah.
you know.
Right. Yes,
Okay.
no, right.
So now you go down to, well, if you, what are the reasons that you're feeling like this? And then we're going off. I'm not as worried. The first thing I'll do when I hang up is, when I either get off of Skype or get out of the office, is I'm calling one of my mentors and I'm like, here's what we said.
Right. Right.
Do I need to refer this person on? And or is this just saying something? Because I don't know enough. You know, even in 15 years or whatever it is,
Right.
I want to make sure. I've had a couple people say this, and the one that said it, I had told her over and over again, do not threaten to kill yourself, because I will call the police.
Right.
I will, you do not call me out on this, because she had that personality of wanting
Right.
to see how far she could push
Test
me.
you.
And see what she could do, and am I going to really do what I say I'm going to do? And she called me. She wrote me the email, I'm going to kill myself today. That was it.
That you have to respond to.
I said, okay. I called the police. I called her cell phone. I called her parents.
Exactly.
Well, no, before I did all that, I called Loretta Sparks, who's an EFT master and was the head of psychology, not the APA, but one of the associations. And she's like, what time is it? I'm like, what time is it? What time is it that you're talking to me? What time did you call me? What time did she say this? Where's the email? What, she gave me this list of 10 things. She said, call somebody, if you call the parents, do this, and do not do this. And I was like, I need to write all this down. Hold on.
Right.
See, you guys are going,
Well, I'm nodding, but can I just say that the only reason I know this is because I went and found out.
Right.
Because I had a client and thought, whoa, and I immediately went to qualified, licensed, etc., whatever you want to, I need guidance on this one. You're fine, okay. They gave me forms. They gave me a list of questions to ask. They gave me the safety protocol, what to do when you have a client who has a history of a suicide attempt or something. So I have this long list of things, but I had to go out and get it. Kathy, confidentiality is obviously very important. For those of us that haven't been trained in its importance, we know it's important, but we haven't been trained in it. What could you tell us about it?
One of the important aspects for keeping clients safe is that they believe they can come into your office and tell you whatever without getting around, without everybody in the whole world knowing, unless they choose to tell them. So the client can tell anybody anything they want to tell them. But as a practitioner, we can't talk about our clients. And so if we were to talk about a case, we want to make sure that we don't mention the person's name or occupation or other identifying types of information. And it's a little more complicated than it might appear, because sometimes we can think that we have washed all the data, all the identifying data out of a case, and yet we provide a specific type of information that someone can know from. For example, I was talking to an attorney one day, and he said, there was a psychologist at my house, and we were just having dinner. And he was talking about a case of a child, and he didn't mention the child's name, and he didn't mention the child's age, but he mentioned an event that happened at a baseball game. And he provided sufficient enough information that this attorney had known about a friend of his whose child had experienced that event at a baseball game. It really didn't require a whole lot of effort to figure it's an unusual enough event that I know who your client is. You have just revealed the identity of somebody you're seeing without noticing it. So it's important to recognize that holding confidentiality is a complicated issue, and we need to make sure that when our clients come to us and they think they're telling us everything and we're not revealing it to anyone else, that we're not. And then if you want to be able to talk to someone, or if a client says, I want you to talk to my doctor, or I want you to talk to my other practitioner of some type, I want you to talk to the school for my child, we get them to sign a release form. And this release form says, you have my permission. And the release form is going to say that you can get information from, but you can't talk to. Or you can get information from and you can talk to, or whatever. So the client has the opportunity to say what types of information you can get, or whether you can only get but not receive. I mean, only get but not give, whatever.
It's an important distinction.
It is an important distinction. So they really have to check both places on the consent form. And in psychology, we're required to make our consent forms time limited. So I can't get you to sign a consent form forever.
Oh, that's interesting.
Yeah.
That is interesting.
So every year, it's a calendar year. So you signed it in July. You're my client, you signed it in July. The next July, your consent has just expired. So if I want to talk to somebody else about this client, I have to have them sign it over again.
My thought then, sorry for interrupting you, was because we had a difference come up earlier that some EFTers actively seek testimonials.
Right.
So they obviously agree at that time, and then it will go on the website, which I know you're not allowed to do, but we do.
Right.
So it's just there until whoever decides to take it down
forevermore. Well, but again, even if a client says, I really appreciate the work you've done with me, I feel like a different person. I have a new lease on life. And I'd really be happy to put on your website that Dr. Sherrod really helped me. I'm not allowed to do that because I'm not allowed to take a testimonial. And even if I were to take the name off and say Jane Doe made this specific comment, Dr. Sherrod's work with me was very helpful, I'm not allowed to take a testimonial with or without the person's name.
I was doing a flyer for one of her trainings, and I'm a marketer, and I said, well, can I say this? No. Well, I've been to your trainings. Well, I can say that that you do a very good job. No, I can say, and I'm like, and it was driving me nuts because how am I going to let people know what a
Just
great
how good
trainer
she is
and how much?
Yeah, I mean,
and she's just like, no. I started getting a little bit irritated. I'm like, well, how am I supposed to get people in your class? And finally, I just have to list her, 1972 or wherever it is that you got your PhD,
right,
and that you've seen this many clients, and then you've been published over here, and that's all I could do.
Specific data I can tell people. If I am certified in a particular area, I can say that I've studied these subjects, but I can't say it I can't claim to be an expert in an area. Even if I'm certified in that area, I can't claim to be an expert in that area because that's claiming that at a subtle level, that I can help you. And I cannot claim to do that.
I think the difference here is for our viewers is that because I'm from the video world, I always get releases. When I get testimonials, they have to be true, and people laugh. People laugh when I say that. I say they have to be true,
Right.
you know, and I don't understand why people wouldn't. Why it's a testimonial. And do you want your initials? Do you want your name? Do you want your website on there? Because some people want to use it for their own advertisement as well.
Yeah.
So I just always get permission.
Right.
And if I say, if you send an email to me and saying, oh, you did this great thing, I'm going to always ask, and I'm going to get that email back, and they live together. And if anybody ever says I've changed my mind, it comes down. And even on my videos, I had this beautiful video of a woman for the first time in her life. I brought a snake in from a pet store, and she had signed the video waiver. I have her doing EFT session of just aspects, one matrix, and the next thing, the snake's in it. She's petting it. And it was just so beautiful. And she signed it. She was excited. And then I got an email 2 weeks later going, you can't use any of it. And I'd rather not discuss it. My intern was sitting there, and she goes, you can't. She signed it. She signed it.
Oh, no.
You know, and I said, legally, yes. Ethically, no.
Yeah.
And she's the only person in my however many years I've been videotaping this that has ever gone back.
Right.
And ever said no. Because they realize that the reason I do this is not, Karin's great at this. The reason I do this is because I want you to realize that this can help you, and you to realize that this can help you, and you to realize, because you're a counselor, to use this tool. So I have to get other counselors to say things, right? Or I got to bring people there. That's why I do it. And you just have to ethically, if they say, you know, that's my first time.
Right.
She said no. I mean, I'm like, ooh, this snake. You know, but oh well.
Yeah.
So I think the point is if you're going to do it, you must get permission. And the other thing is, if you're a trainer or you're telling somebody to try to teach them or explain, you have to change the person's names. You have to change enough of the details. You know, switch sexes. You know, whatever you need to do. If it was a fear of snakes, and now needs to be a fear of spiders. Whatever you need to do, as long as the details are a lot.
Right.
Now, having said that, my clients often want me to use their names because they want their real people.
Absolutely.
With real issues, but not about you.
But not about me.
I can tell her, right? You
can tell her. Yes, or anyone else. Orally, you can tell someone else that I've been to this training by this person, this psychologist, and it was really great. I hope you go and enjoy it too. That you could do because you're not me. I can't
self-promote.
I can't self-promote, nor can I allow you to promote me, basically.
So can I have your picture on the flyer? Yes, you can have my picture. Okay.
Right.
Thank goodness.
That's pretty much it. It was pretty limited. Back to the consent form. You were saying that to a certain extent, after somebody signed a consent form legally, that's a contract, as it were. For us, a person can rescind consent for us to communicate with someone else at any point.
Yeah.
So if I've had consent to speak with a school, and we've done a report on little Johnny, and we have a consent to send the form to the school, and we have sent it, and the day after, the parent rescinds the consent. I mean, we can't pull back the report because it was sent out under a valid consent form. But then if the pediatrician wants to talk to us and wants a copy, they can't get a copy from us.
Because the contract's changed.
Contract's changed. The parent has rescinded that contract.
Complicated.
It is.
Yes.
Go ahead.
Yeah, I was just going to say, it actually brings up a lot of questions for me, being someone who is new to self-promotion. But no, learning how to get out in the world and show what I'm doing with energy while being careful with my licensing body, which is by state, by the way. So I'm wondering, from you all have websites. What can you put on your website? What can't you put on your website? Because what I hear about is, you know, people are Skyping doing energy work. People are doing energy work online. People are doing, you know, and I know that I'm going to need a waiver and I'm going to need, probably insurance, which I want to hear about too. But what do you do on your website? What can you?
The biggest thing from our point of view is there's a whole story with EFT Master Rue Haas that she had the word energy psychology on her website. And went into a whole legal nightmare. And now she's studying to be a minister because of that. It's the same thing, but she has had the words energy psychology, and she's not licensed. And once we really start working well, once this stuff starts working, and you can't stop the word of mouth when people say, I had this for 25 years and now I don't.
Right.
In 2 sessions or something ridiculous like that. You're not going to shut them up. They can go out there and say
Yes.
that. And
Yes, they can.
So it's going to go out there, and the more it goes out there, the more it's going to ruffle feathers. And they're going to start reading your website. So you can say, counselor, I can't. You can say psychology,
Right.
I can't, if I want to stay safe.
Right.
Do you see what I'm saying?
Yeah.
My question to you, and the other thing about insurance, because we are similar, at least in the United States, you do body workers insurance, like liability, that's if people fall down, on your property. It covers a lot of things. If you go to any of the body workers, and I have a list on my website, well, lots and lots of places to get really good and not too expensive insurance that works well because it's been tested by body workers and things like that. So I do have a question that you might be able to answer.
Okay.
Because I don't know the answer. Could Casey have 2 different websites? One only directed for energy practitioners and one only directed for traditional therapy?
Oh.
That's a really interesting question. And because it exceeds my actual knowledge.
Something exceeds your knowledge.
It does.
I've never experienced
This is when I would go to the board.
Okay, that makes sense.
And I would say, okay, we have a counselor who does this work, and we have a counselor who does that work, and one set of work is covered by these sets of rules, and the other set of work is covered by those sets of rules. And I imagine that it would make sense to have 2 different websites so that you could present what is acceptable here in the licensed part, your degree, where you got it, your specific license, the types of issues you might work on. I've worked with people with anxiety or depression or whatever, and your location, and that's pretty close to it.
Can you list the modalities you use, though?
You can list the modalities you use as long as you don't say you're an expert in them. So,
Okay, so she could
studied
say-
Gestalt and
EFT and matrix reimprinting.
oh yes, she could list
She can
all
do
of it.
that.
She just
She
can't
could
have
list those.
testimonials.
Right, no testimonials. Right.
And no whatever else that she can. But on the other side, if she
On
could
the
do
other
that.
side, I would imagine she could do that. If I really wanted to know, I would have to run it by the board.
And you're saying board, but I want to be clear that every state, at least in the United States,
Every state has a different board.
rules.
And this board, there's a board of psychology, there's a board of social work, there's a board of licensed professional counselor. They're not the same board, and they don't have the same rules. So that if you get licensed in one state, you are not licensed in another state, even if you have taken a national exam. In order to get your license in Tennessee, and they use the same national exam in Georgia, you cannot move to Georgia and automatically be licensed. You have to fill out a whole new set of paperwork, and they might have some additional requirements. Who knows?
And you can't Skype, correct?
Correct. I can't Skype. Now, I'm suspecting that just as I didn't used to be able to get continuing education credits for energy psychology or energy modality trainings, and that's changed, I'm suspecting that eventually psychologists will be allowed to Skype. And the reality is, I know psychologists who Skype now.
Yes, so do I.
But
But isn't that your state? Because the one I know is from Maryland, and
and yes, it can vary by state. But I actually know psychologists in this area who, if their clients are out of town, traveling, they Skype with them. And I am bound to report ethical problems. It doesn't strike me as an ethical problem to have contact with your client who's on a business trip in another state. And complicating things people want us to only work with people within our state. I'm only licensed to work in Tennessee. So if I were to Skype with someone in New York State, I'm not licensed to work in New York. What am I doing working with a citizen of New York?
But you're allowed to if they are a resident of your state and they're just out of town.
Right.
Well,
No, because you can't Skype.
Kind of, sort of. Well, right. You see the problem.
Oh, I do.
So the reality is that this is a rule that is not followed by people who have a clientele who travels. Now, for people who have a clientele who never travel, they're fine.
Yeah.
But I'm telling you a reality that people whose clients travel, as a psychologist, if my client is out of state and wants to talk to me about an issue that came up, I'm not likely to say, why don't you give me a call in 10 days when you get back home? I'm so sorry that you're having a panic attack in your hotel room. That is not my problem. That answer doesn't work well for me. And so
telephone presumably is
it's
also
the same.
included. It's just
That's very much the same.
assistant, therefore.
You're supposed to do
Yeah.
face to face.
This is probably why insurances will cover Europe for me, and then you've got to take out a separate one for the States.
Probably.
Most
Same
likely.
as Canada on my website, because I teach this all the time all over the world. I have, here's what's licensed, the licensing bodies and the, not licensing bodies, insurance bodies for Canada. Here's insurance for the United States. Here's insurance for Brazil, because I teach there
Go
too.
there too.
I have people from
Right.
India, and I'm like trying to look up people from India, and so it gets really, it does get really interesting. It
Right.
gets really
Right.
interesting, and you have to really check up on it, because what you're doing is you're planning for the worst case scenario.
Right.
And one of my worst case scenarios that I remind people who are in my class is, if you're working with somebody who has a very, what do you want to call it, like a disease like cancer, an illness like cancer, and it's not the cancer, the person with the cancer that I'm worried about. See, because they came to me for me to help them with, not to cure them.
Right.
They came to me to help with whatever their chemotherapy they're going through, whatever reasons that are surrounding their family, that they might die, all the emotional issues.
Stresses.
Their family can easily turn to me and go, you're treating her for cancer. You can't do that.
You're not an oncologist.
Right. And I have to say, I'm not worried about the person who's coming to me, because they're feeling better about the whole terrible situation. Right? But the family is what I'm really worried about. What are they going to do, say, and be? And that's why I have to make sure that all the insurance covers things like that as well. Because you don't think about that. You don't think about that.
You've got a client in front of you who needs
until you have
help.
experience.
Yeah.
Right.
And that's why we learn so much through experience. And back to how things change, decades ago, if a psychologist were to go on a talk show and talk to a person over the radio or TV, that would be a good way to lose your license. That's no longer true. They changed the law.
Well, isn't that good news, though?
Isn't that good news? So I've been around long enough that I have watched a variety of concepts change, laws change, expectations change.
Introduction of the motor car.
That was
sorry.
just me.
I know, but I'm sorry, but it's actually, I'm using humour, it's my British sense of humour, but you've been around a few years, but they are massive changes, aren't they? I'm
They're
sorry,
massive.
they're massive changes. She'll get me later, I know, yes.
This is true.
British humor is.
Yes.
I want to talk about not being attached to the outcome. I mean, we hear that.
yeah.
We hear that a lot. And especially healers, especially people who work with energy modality, especially someone like me who, I've most of my clients, they're all happy in, 3 to 6 months and they go on their merry way. And then when I get somebody that's 7 months and 8 months, and I'm like, then it starts not attached to the outcome is really getting to me, and I have to work at going, they're coming to me for assistance, not to be, fixed or anything like that. And then I start feeling bad because, they're spending money and there should be more changes. And then you go into that shoulda. And you have to really work on that, because in the beginning, it was really very difficult not to want that person to feel better. And that's being attached to the outcome.
Absolutely.
So what training have you guys had with that?
Partly training, partly experience. And interestingly enough, when I was in graduate school, another change. I was taught that if I had worked with a client for 2 years, I was ethically bound to refer them to someone else because I clearly was not helping them. It was just very simple. 2 years, and I should have had them fixed, and if I didn't have them fixed, I'm incompetent. Well,
I'm thinking of all the times that take more in traditional therapy.
really?
Longer than 2. I mean, people are there for 20 years and they finally things get better.
I know. So imagine my dilemma when my first client reached the 2-year mark.
Oh man.
This was not easy. And so I did what I do, is I talked to people who are not officially supervisors. I didn't need a supervisor at that point, but a mentor, a friend, someone who might know. And I said, I have this little problem because the person is getting better. And I believe that if I say, well, I can't see you after another 4 weeks, this is a slight case of abandonment. And I actually talked to my client and I said, look, I'm going to be completely honest with you. I was taught that if you weren't ready to complete therapy at the end of 2 years, I should refer you to someone else. And I'm going to tell you what I was taught. And I'm going to offer you the opportunity that if you believe at any level that somebody else could help you more than I could, I will be happy to help you find another therapist. I will do whatever it takes for you to feel comfortable in this process. But I am also telling you that regardless of what I was taught, if you believe that you're getting better coming to see me, I will continue to see you. And the client said, please don't send me away. And I said, I won't. I mean...
So it was a suggestion or a recommendation rather than a requirement?
It wasn't in the ethical rules.
Okay.
It was what I was taught as a hard and fast... It was taught as a hard and fast ethical rule, but it was not in our stipulated ethics.
Okay.
It was what I was taught in my program.
Mm-hmm.
It was not in the American Psychological Association ethics. So
you weren't prohibited?
I was not prohibited. I was taught that that was best practice in my program. I was not prohibited by the American Psychological Association. And I said, forget what the program taught me. There's something wrong about that. And I stayed with the client stayed with me, whatever, and did in fact reach the end of therapy and did get what she wanted. And so after that...
But we can't say you're good at what you do.
No. No. We would not step over that. But back to one of my really firm foundations on don't be attached to the outcome was I spent 15 years working as a psychologist at a state psychiatric hospital for children and youth. So we had kids from 4 to 18. And let me assure you that by the time you get to the state psychiatric hospital, you've been in residential programs and you've been in group homes and you've probably been in private psychiatric hospitals and you've been everywhere they know where to send you. And that's sort of a last-ditch stand. So our kids had real problems. And I had a lot of interns, and I would kind of sit them down at the start, and I would say, these kids did not get here without having a very long history of problems. It is our job to go there every day and do our job. It is not our job to change them, to fix them, to be their hero, to do anything specific with them. Because the only thing we have control over is that we do our job to the best ability we can. And the only way I know how to go back there every day is to be comfortable that I'm doing my job. Not that I'm accomplishing something with the clients, because that's a client population where change is slow for many of them. And change is pretty close to non-existent for some of them. So, and people would ask me, don't you just hate going to work there? And I'm like, no. I love going to work there because I go every day and I do my job. That's what I do. And interestingly enough, some of the kids change. And I'm not going to take ownership of who changes, but if I become too attached to whether or not this particular child changes, then I can't go back fresh the next day and put all my energy into my job. Interestingly enough, with all the interns I had, most of them heard what I was saying. I did have one intern who looked at me one day and said, "So basically you don't care about the kids."
I was waiting for that.
I'm like, wow, how did you get that?
How did you put that with that?
How in the world did you get that from what I said? So I gave the same little talk to all the interns, and most of them understood that I expected them to pour heart and soul into doing their job. And then not to be upset if the kids didn't change, because that was not under our control. What was under our control is that we did our best. And it's really good lesson for me, speaking of not taking responsibility for the outcome, is that one intern who heard me say that I didn't care about the kids. I'm not interested in taking responsibility for what she heard me say, because she had responsibility, because everybody else over decades.
But see, that's what I'm saying. That takes work. That takes practice. I had many times clients, students, people in my class, they say, "But you don't care." And I'm like, well, here's the thing. I finally found a way to do it.
Oh, good.
So I said, okay, here's me caring. Okay, I want you to be better. I want to make sure that I'm good enough for you. I need to make sure that we are going somewhere so that I'm doing what I'm supposed to do. Do you hear what I'm saying? It's my filter. Once I stop caring, what the cool thing happens is that I get to care on a whole nother level. And once they realize that there's still care there, it's just a completely different kind of care, because the care they're talking about is about them, and I want to help you.
Yeah.
And when you stop doing that, suddenly, and it was a poof, it was an aha moment, I realized that I can care much better because I don't care. And when I say that the first time, people go, huh? But that's what you do. By me not caring, it's not about me anymore.
It's
Correct.
taking yourself out of the picture.
Yes, and so now it's still care, because I wouldn't do what I do if there was no care.
Of course.
But it's not the same kind. And
you're getting yourself out of the way.
Yeah.
You're not the center of the picture.
Right.
I know I can help you. You got problems, and I'm wonderful.
Yeah.
Right.
We have no time to deal with them all.
Yes, pretty much the center of the universe.
So it's probably not a good idea to work on family members. We know that, but in the UK we can. I was working with a family member because they won't go to anybody else or do anything else, and I contacted somebody and I said, "Will you help me, because I obviously have attachment to outcome. So please, will you help me separate?" And we worked, and we did a really good session, and I can now observe myself working with them, but I knew I had attachment to outcome. I knew.
How can you not?
Exactly, exactly. So I had to do a lot of work around it. But you actually get better results that way. We know that.
Better results when you pay attention.
Yeah.
To what you're doing. And that's what this whole video is all about, is because you don't know what you don't know, and we're trying to help you at least a little bit.
What we're trying to do is, it's mistakes that we've seen other people make and things that we've done ourselves. We don't want you to do that.
And I'd like to say, just being a newbie, more so than a few of you, in graduate school, it was more of an undertone of you're here to help people, heal people, make them better. So if you're not seeing progress, you're doing something wrong. Possibly take care of them. There was a lot of that, and but it's an undertone. It wasn't said straightforwardly to me or anything. I never heard that said. But so what I experienced was, coming out of that, I went to a church counseling center. for a little while. I was under supervision, but so that encouraged me to, I learned from all of them a lot about it. It was beautiful. But I had support there. And so even all the messages I got in graduate school, I had support there. Well, then I went to a private counseling center, got whole different experiences, but I had support there. And then I went to a behavioral health center, and because I had all that support, and I then was on my own at this place, working with clients who had no coping tools, no skills, no way of taking care of themselves between sessions, maybe but their medication. I had so much support that I was able to not be so attached to the outcome because I'd been supported through that. I'd been given tools and learned how to not care as much. I still cared some, definitely, but not care as much. And that was really nice. Because then these people would come in and they were suicidal and they were murderers and they were in prison, in their prison garb, and they were, I didn't know. Hi, how are you today? I have no idea what I'm doing. So I have to say that having had that support and having had people help me learn, maybe unlearn a little bit about being so attached, was lovely. So I do think what you all are saying, just having that learning is so important, and I really, really agree with that. So
it is very important because I say that when we go out and we learn EFT, and we do our first course and we think, wow, this is brilliant, we all go through the stage of tapping on everything that moves or tapping on anyone that doesn't move quickly enough. And boy, is there an attachment to outcome there. That I can cure you, come here, let me cure you. And you have to...
Yeah, you can't.
We have to go through it our own way and come out the other end, don't we?
Yeah, and you know, some people don't even know you can't say heal and cure. I mean, that's how simple it is. People, you know, just can't say heal and cure
because you haven't learned it at that point.
Well, not even. I mean, even if I tap with you and poof, your spider phobia goes away, I didn't cure you of your spider phobia. And people don't know that, and they'll use that wording on their websites. They'll use that wording on, you know, and they'll use that word come falling out of their mouth when they're, you know, doing it in a network saying, what do? You know, I heal people. No, you don't. You know, I can help people heal themselves. There's a lot of things you can say. So, and I don't want to overwhelm everybody. You know, that's what this DVD is about. That's what this video is about, is so that you're just aware. I want to talk about something interesting that doesn't seem to be like part of what we would talk about. And it's something came up because I was talking to Sophia Kayer, who's an EFT master and that works a lot with vets in Florida, war vets. And we had this great conversation of how many clients do you see a day? And how much time do you in between clients? And, you know, Sophia and I were going, well, I put a half hour between each of my clients because I need to be present for the next one. And that's how I do it, is I walk around the house and, maybe tap on myself, have a drink of water and clean up and whatever I do. And then I'm free to look at who's ever coming in, and I'm not doing this because I've done the other way. I had 10 clients in one day.
Oh my gosh.
I went to a church in another state and they couldn't come to where I was. So we just set up an appointment, 50 minutes, 10 minutes, 50 minutes, 10 minutes. I saw 10 people and I went, heck no. I will, because that's not good for them, let alone me.
Yeah, that's not good for anybody.
Surely be fully present at the end.
No, it's like once. That happened once. Never, ever. I mean, it was sort of an emergency situation, kind of, sort of, but I could have been 2 days. I could have stayed overnight. And I would have if I'd known now what I knew now. So what is normal in traditional therapy? You're both going, oh my goodness.
Well,
normal?
I mean,
what normal?
The first thing I think of is at the behavioral health place I was talking about a minute ago. I was seeing, I even want to say it was very much Band-Aid therapy because it was get them in, get them out. And so 15 to 30 minute sessions, that was considered a therapy session. And an hour, I was pushing it. You better get them out of there. And I needed time for my notes, but quick time because we're making money here. So we got to, quick time here. So it was, so I was seeing a lot of people every day, 10 to 15 people every day. And I worked part-time, and they kept asking me to go full-time, and they couldn't understand why I didn't want to work full-time for them. They just couldn't understand that, and I wasn't being paid very well. So when I, just knowing that from experience, I'm like, there's no possible way, like, I don't know. So I would say 5 people in a day is a lot.
Can I say
It's a
something
lot of
here?
work.
To do that, did you feel that you, as Kathy said earlier, you put your heart and soul into the job? Could you put your heart and soul into the job under those conditions?
What I want to say is I wasn't putting my heart and soul anywhere near that place. And instead I was going to work every day and doing what I was supposed to do and to the best of my ability. And then I was going home at night satisfied that I did the best I could do. So what Kathy was saying, yes, but as far as heart and soul, I was trying to stay detached as much as possible. And I was calling my support system and other people and saying, woo, today was a tough day. I need a little help or support, and we were doing things. And that was actually while I was training in energy work. So I actually was working on myself at night a lot, and in between days a lot, because I needed the extra support to get through that. So yeah, it was definitely about just doing the job.
Having said that, given that I was on the other end of the
Yes, a
phone
lot.
more than once,
More than once.
I am aware of several of your clients.
Yes.
I mean,
Yes.
I
Oh, true.
got their patterns, and you would say, you know, how might I approach that one differently? Is there anything you think I'm missing with this one? So I'm hearing you say that you just sort of went there and did the work, but that's not exactly
It's maybe not entirely
my
true.
experience.
Yeah.
You were doing as much as you possibly could in the short amount of time you had,
Thanks for saying that.
and you were burning out.
But I was going to say
I was.
exhaustion.
I was.
I mean,
Well, I was-
exhaustion is going to stop you putting.
Yes,
Yeah.
You know.
absolutely.
The key I'm seeing here, though, is the way she felt. And you heard on the other side the way you felt.
Yeah.
So you have to know that you're going to have feelings
Yes.
about it. You know, and if you need, like me, to have half an hour between clients, because that's what I think
Yeah.
I
Exactly.
need, or I get burnt out or upset or not, not paying, I'm not giving enough, or whatever the terminology is.
Right.
I want a half an hour. There are a lot of people that do 15 minutes. There's a lot of people who go 45-minute sessions in 15 minutes, and a 45-minute sessions in 15
Right.
minutes of not. And it did help a lot. I don't need a lot of notes now. I take notes during my sessions instead of like spending a bunch of time beforehand
Ooh,
and then
yeah.
afterhand. I do a lot of taking notes, and before I wouldn't give myself that because I have to be there for that person. I got my whole attention. Don't
Yeah.
take notes, and then I'd spend so much time taking notes afterwards. And I'm like,
Wait a minute.
why don't I just take notes? They know I'm trying to, he's sitting here doing my job. Take notes. So now I have a computer and I sit there and take notes because what longhand wasn't working. And these are the kinds of things that you learn
Right.
by doing.
And again, I was taught not to take notes during sessions, that was completely inappropriate. And I decided decades ago, that was a ridiculous idea. And so I sit there with my clients, and periodically someone will say, what are you writing? And my answer is, it's your record. At any point, you can sit down and read the whole thing. You can have a
Absolutely.
copy of the whole thing. This is your record. What I was taught, and I'll tell them, I'm pretty straightforward with my clients, what I was taught was that I should write the notes at the end of the day. And I discovered,
At the end of the day.
well, or after the session,
Oh, okay.
but then if someone else was coming in or somebody asked me a question, it didn't get done right at the end of the session. It got done at the end of the day. And I said, by that time, I'm just kind of writing generic notes. I don't exactly remember what happened. So the reality is, I want to know what happened in the session. So I'm writing down the notes right when they're fresh in my mind so that you and I can accomplish as much as we can accomplish. And by the way, I am required by law to keep a file. So I have to take notes at some point. I'm either going to take them now or I'm going to write them later. And I find them more effective now.
I actually will turn my computer around and say, this is not secret. I'm not writing anything
yeah.
about you. I'm writing what you say, what
Yeah.
I need, what needs to me to remember for next time. And it's not because I don't think you're a wonderful person. It's because I have a few clients, and if I had to do the best job that I can for you, I'm not going to remember it. I'm just not.
Yeah.
You know, maybe if I had one client a week, then perhaps I would, understand it more. But I don't even, their father died or something like that. I got to look that up, because even
Right.
something that seems so devastating, we never really talked about it. But I need to know that I can't bring that up, because it was
Right.
3 weeks ago, even though we never talked about it. So I need to know that, so I have to have that written down. I need to have that
Absolutely.
for safety reasons as well. And these are the things that nobody tells you. I mean, at least us.
I must
Right.
admit, I was sat here thinking, at what point was I told to take notes? And I was going back in my mind trying to, because, yeah, you make notes. But when was I told to? Interesting.
Oh.
Because how can you do the best job for your client if you are seeing several clients?
Right. Yeah, if you expect yourself to maintain all this information in your head, you will merge people. I don't know.
And it doesn't have to
anybody.
mean that they're not important. It's
They're
just,
very important. I'm limited.
Right.
They're very
Yeah.
important. I'm still limited.
Yeah.
So, that's why I need the notes. Although for me, interestingly enough, writing the notes is usually sufficient. And so I don't often go back and review them. And
It
people say-
actually goes in when you write it
it
down.
goes in when I
Yeah,
write it down.
yeah.
So unless they do something where they don't come back for 8 months, in which case I do have to read the notes. But if they're coming pretty
You are
regularly,
limited, yeah.
I am indeed limited. But if they're coming pretty regularly, then it stays in an active form.
well, this brings me to a question that might be off topic, but I think it is kind of on topic, because there's a specific reason why I need the notes more now, and it's not just the number of people. It's because I use an intense amount of intuition for rapport, for knowing, like, we can't go over here right now, we need to not to go
yeah.
over there. Is this safe over, is this safe in this particular circumstances? What that person said, these set of words doesn't feel like this set of words. So I write, in my notes, you'll see, this is what the person says, and in parentheses it says Karen feels,
Right.
right? Because I'm using a lot of intuition, especially with people who analyze a lot, or I've been searching for this problem for a long time and can't get to the base of it. I'm sort of reading between the lines as well. So I have to take notes, because I won't remember this happened first and this happened second. So that's when I wanted to say that, because that's one of the reasons some people use a lot of intuition and some people don't. And I don't want to get into a whole what is intuition in this conversation. It's just, other than just information I want to find out about what's going on. Do you guys use intuition in traditional therapy? And is that taboo to talk about? Or?
Sort of depends on which theoretical perspective you're talking about, whether intuition is encouraged or even believed in or not. For cognitive behavioral therapy, a good portion of the idea is to pay attention to what you see, the observables, the things on which one could collect data. The distorted thoughts for the cognitive part, the number of times I'm late to work for the behavioral part. So in that case, one would be encouraged to stick to the observables and not my intuition, because my intuition will only get in the way. Okay. If one were to switch to, say, Gestalt therapy, where frequently a Gestalt therapist will say, the energy just changed in here, what happened? Now, having said that, Gestalt therapists will not generally talk about using intuition. So it seems inevitable to me to say that I noticed that the energy in the room changed. It's intuition, it's a recognition of energy, call it whatever you want to, I don't know. But what Gestalt practitioners are taught is, when you said that, I felt something in my stomach, in my chest, in the back of my neck, whatever. That's what I felt. I'm not suggesting that you felt anything of the sort.
Exactly, yeah.
But this was my reaction to what you said. So there's very much...
Does that mean anything?
it very much an interplay. Not so much does that mean anything, but I'm just telling you how I reacted. Because when you said your mother hit you, I found it hard to breathe. And sometimes for clients who had not noticed their own reaction, there is a modeling that things happen in our bodies. And some of our clients come to us, and as a friend of mine likes to say, their head's on legs. There is no body to react. So if you ask them, where do you feel it in your body? Nowhere. Where do you feel it? I don't feel it. I'm just telling you that when I was 4, my mother hit me. I mean, what? Anyway.
No, that's good.
So for us in regular therapy, it sort of depends on what perspective you're in, how much intuition is relied on or disavowed. And yet the reality is, experienced therapists, from my perspective, are relying on intuition. Because you watch an experienced therapist working with someone and you're like, how did you get from here to there? There was no bridge. You know, you just kind of, Scotty beamed you over. So whether people talk about it or not, we definitely use intuition.
Can I interject here just a moment? Can we agree a definition? Because we do that, don't we? When we're talking about something, we always agree the definition of what we're talking about.
Yeah.
So to me, intuition is knowing something without knowing how you know.
Well, I want to just say one thing about normally, that's what we used to do. Intuition is knowing something that there was no way of knowing. But there is now, HeartMath has been doing lots of studies on the heart field and the information the heart field talks to the rest of the body saying, you know, here, you should do this today, or you should be afraid of that yelling over there, but this yelling over here you're okay with. That's why something happens and then you react to it and then you feel the emotion, because that's the order. So I'm not going to go into all that. But there's a field of information.
So there's some science coming in.
And they've done studies where the computer pops up and the body reacts.
Yeah.
And the computer didn't even know which one it was going to show.
And the picture.
And this is the reaction that occurs before
the picture's seen. And it's all scientific, and it sounds out there, but it's a body field. And there are many times that it's like when somebody walks in and is angry and they don't say anything. You know they're angry. You know, there's somebody standing.
The atmosphere with a knife.
Yes. Right. You know, and this kind, it's the body field, it's the heart field. And if you practice, you can pick up. You can kind of start to I don't want to say read it, because that's my filter. You know, I don't read it. I will say,
experience it.
What was that?
Yeah.
Did something just change? And it's a question.
Right.
And I don't say, oh, you are feeling fear. I just feel the fear coming towards me, and I'm like, okay, there's something going on here. And HeartMath shows that I'm just reading the field coming out of their heart.
Question. That's your signal to ask a question, because one of the things that I always say is, when you've learned to drive, how do you know that guy in front of you is suddenly going to turn without warning? But you do know, don't you?
After you've been driving for a while.
After you've been driving
for a
while.
Not when you're new.
Not immediately. Right. When you've gone past that initial stage, you're driving along and you know that guy in front of you is going to do something unexpected. And he does. He just turns off with no warning. And you thought, yeah, I knew you were going to do that. And all drivers know that, and all drivers are actually quite happy with that, aren't they? Because it's all...
Well, I think there are a few drivers out there who don't know it.
Yeah.
But to put it in a concrete perspective, Eskimos have multiple names for snow and ice. So they can differentiate between snow and ice in ways that we can't. It all looks like snow and ice to us, because we have not honed our recognition or definitions. The longer we work in this kind of field, the more we hone our recognition and definition of these things. So that information might have been available to us previously, but we don't know what to do with it any more than we know that this kind of ice works for an igloo and this kind doesn't. But an Eskimo knows.
There's one language that has different words for over there, like there's over there, up there, over there, down there, over there, and there's about 17 different words for over there. And I just remember thinking, oh, that's interesting.
This is very important because one of the hardest things to get people to not do in my energy modalities is to stop figuring it out.
Right.
You know, because you might think it's fear because fear came out of their mouth. Mm-hmm. But fear could be 1,800 different kinds of fears out of them, so you have to ask questions. Mm-hmm. So I may feel that fear coming towards me, or they may say the word fear, but exactly what you're saying, you don't know what kind of fear it is because it's not you. And that's extremely important. That's something that's learned, that you cannot define somebody else's words for them. So you have to ask questions.
What does that mean to you? Mm-hmm. Mm-hmm. Right. Because
what if if someone says, I'm feeling so anxious, I'm like, let's pretend I don't know what anxious means.
Well done, yeah.
Yeah,
that's a good approach.
So they'll look at me funny, I'm like, let's just pretend. And then they go, they're so used to saying the word anxious and stress and all these words that now they have to redefine what it means to them. It kind of puts brakes on, but they have to find out.
Yeah.
The last few weeks has been really good for me. I know we're going back to the language differences again because we think British English and American English are the same. They are not. And I say something and I look up and I think, that was not the reaction I expected. Okay, what meaning do you put on that word?
Yes.
What did I just say?
That's what I always do. I said, I forgot to pack this one thing. I'm not even going to say it because we're going to have an audience. And I say the word and I get this. I'm like, what did I just say?
Right.
What did I just say? I go, well, that means, something else. I'm like, ooh, so sorry. Whoopsie. Oops. So I think that's very important in what we do.
You're talking about being British and coming over here and not understanding us, or going over there and having them not understand us. I like to think of every client as coming from a different culture, because I did not grow up in their home. And frankly, if I had grown up in their home, I would have been older or younger or different in some way, so I wouldn't have grown up in their exact home. So if we think of every client who comes to us as coming from a different culture, then we're not so comfortable saying, yeah, I know what your anxiety is like. Yeah, when you say your mother was hard to get along with or your father was hard, I know exactly what you mean. I don't have the first clue what you mean. So tell me a little bit about what it was like for you. What did you experience? If I had been a fly on the wall, what do you believe I would have seen?
That's a nice one. Yeah, I would say, what do you mean by? Explain that. Yeah, we all have different ways of doing it, but it's asking questions. Don't assume. Never assume.
Because as soon as that happens, you're going to be wrong. I promise you. As soon as you're going down this path, I've done this before. I've done spider phobias. Let's go this. And now you're over here. There are clients over there, and you're going, wait a minute, you're supposed to be over here.
Exactly.
And you do that at first.
Oh, absolutely.
You do, and then you realize that that's just making everything harder.
Yes.
And you have to learn to, if they're going that way, then you go that way. And that just takes practice. And I do hope that this video is helping people understand a little bit more about not knowing what they don't know. And just maybe if something just rings a bell, go look up more. David Feinstein wrote ethics handbooks for healers, I think it was. Dorothy Kramer has one about that. I mean, these are for people who haven't gone through what you were able to go through.
Yeah.
And so there's books out there, and pick up a phone, email somebody.
Always. Yeah.
I pick up a phone. I look at the internet phone book for a licensed person that was in my neighborhood, because I had a client who needed a licensed person and wouldn't leave the neighborhood. Talk about difficult. I had to keep going and keep going and keep going until someone would actually sit down and go, what do you need? And why are you calling me? Because I know that this person needs something other than just an energy healthcare professional. They need a licensed person. We could go together. We could both work together. And that's what I'm trying to find.
I have done that.
Yeah. But you got to pick up the phone. You can't just say, I don't know anybody in the area. Or I don't know anyone who's, or I can't. Or I've never met anybody. There's ways. There's Facebook people. There's Facebook groups. There's, I say when I'm done a class, I'm like, I don't disappear into nothingness. You can email me. It's okay. I even have in my scheduler business meeting, half-hour business meetings where you can actually book a business meeting, as well as group mentoring and all that other kind of thing. So I want everyone to know that, I've called you
Yes.
numerous times.
Yeah.
Because there's I need to know, make sure, like you did, that we're going where we are safe to go.
Yeah, definitely. I mean, yes, I have gone out of my comfort zone, with one client, but there were just reasons that, and I just thought, well, I need help. So I immediately found 3 people. I said, yeah, I've got to accept this client. I need backup.
And I think the 3 people is important, because I remember there was one specific case that I had to call 3 different people, who had expertise in these same things, because I got 3 different answers. And then I went,
you don't always get the same answer.
and they were similar, of course, but they were 3 different answers, and which was also good for me, because one was similar to what I was doing, another was completely opposite of and so I had to make it very clear to me to work with this person what the situation was.
Yeah.
So I'm glad you said 3 different people, because one person all the time is not enough, because everybody has
But I
different
did
experience.
that instinctively.
Yeah, of course you did. Which is why we're sitting here doing it.
good instincts. And as recently as within this calendar year, someone called me about seeing them. I'm like, I'm not sure I'm the therapist for you. I'm really not. And so again, I called somebody and said, also very experienced, and I said, okay, this is the situation. What are you thinking? And she said, no, I don't think you need to be seeing this person. I said, yeah, that's kind of where I am too. And so, but I'm looking for somebody to say, well, I think you should. And I'm like, okay, why? But because I was open to either direction, really.
But you questioned.
I questioned.
So therefore
then I'm seeking input from somebody else. Anytime I'm not sure of an answer, and probably sometimes when I am sure of an answer I should check, but I definitely look for input from other people. It's very important to me.
And you were here when the car was invented, right?
I was here when the car was invented. I remember it well.
Yes. So if it's been that long you've been doing this, we'll never let Fiona live that down. But the important point is even someone with a vast amount of experience and a lot of different modalities and methods. And
I still need help.
Yeah.
I always think that every person I meet knows something that I don't.
Yeah.
And when I know that I want to know something in a certain area, and I will go to the person that I think can tell me that.
Yeah.
So is there anything anyone wants to add here?
I wish I'd seen this when I was beginning.
And me.
Yes.
And me.
Me too.
And me.
This is really nice.
And if you guys are saying that, that's good.
Yeah. I'd say we're on the right track.
Yes, exactly. All right. Well, thank you all for taking quite a bit of time. And our camera person, Ferris, and our host, Cindy, and Mike, who just over there, who's dragging us all around, and your home, your office, and it's so great. Thank you.
Thank you.
Thank you. Thank you for doing this.
It was needed.
Yeah.
Yeah.
It was needed.